Okay, let's go ahead and pick up where we left off. Remember? Popliteal fossa. Medially, semitendinosus, semimembranosus, and gracilis. Laterally, biceps femoris. Inferiorly, we have our gastrocnemius muscle, which has a lateral head and a medial head, making up the lateral and medial aspects inferiorly of the popliteal fossa. Let's remove some of these markings so that we can see things a little better. Oh. Blood vessels. Blue. Okay. Great saphenous. Here. Small saphenous, sometimes referred to as lesser saphenous. This vein empties into the popliteal vein, which is here in the popliteal fossa. It is the inferior name of the vein, which superiorly was the femoral vein. Make sure you preserve the small saphenous and great saphenous. Adjacent to the small saphenous is the sural nerve. I would like that preserved also, and I want you to make sure that you preserve our common fibular nerve, which is adjacent to the biceps femoris tendon and is a branch off of the sciatic. Please note that our small saphenous and sural nerve runs typically together, but not always, and will run lateral to our Achilles tendon, and then will curve behind the posterior aspect of the lateral malleolus, and then join the great saphenous vein on the dorsal aspect of the foot. So both of these veins will be draining our foot as well as lower extremity superficially. Now let's move to the upper extremity. Muscle-wise, refreshing our anatomy, deltoid, trapezius, latissimus dorsi, triceps brachii, lateral head, triceps brachii, long head, and down in here will be our triceps brachii medial head. This view does not show the anconeus muscle. I'll point that out later on. This here is our olecranon process. In this area, on the medial upper extremity, is our basilic vein embedded in the subcutaneous fat. Adjacent to the basilic vein are going to be three nerves. So in this area you will find three nerves accompanying the basilic vein. One is the ulnar nerve, one is the median nerve, and one is the median cutaneous nerve of the antebrachium. So right here, this is our ulnar nerve. And you know it is the ulnar nerve because as you follow it down, it runs posterior to the medial epicondyle, and that's the one that you hit, and it's quite superficial. It's the one you hit whenever you hit your funny bone. Let's advance. And in this view, again, here is the ulnar nerve. And from this view, we have a much better view now of the anconeus muscle, a really small muscle and difficult to find or difficult to uncover because it's covered up with a nice, strong, deep fascial layer. Long head of triceps brachii, lateral head, and down in here is our medial head. Some other things to note, again, olecranon process, and then the muscles right here. We need to take a look at these muscles and determine if we are dealing with extensors or flexors. And so if we're on the dorsal aspect of the antebrachium, those will be extensor muscles. If we are on the ventral aspect or palmar aspect of the antebrachium, those will be flexor muscles. Other things here, trapezius, latissimus dorsi, and external abdominal obliques. Gluteus medius and gluteus maximus. And of course our cluneals. Now this view is important. We have to reorient ourselves. This is the anterior view of the upper extremity with emphasis on the cubital fossa, also referred to as the antecubital fossa. You'll see it mentioned either way. Now before we get into the muscles, let's talk about the veins. These are superficial veins. They are embedded within the superficial fascia, which you will remove after you remove the skin. So here we are. This is at the anatomical position. However, your cadaver is not going to be in the anatomical position as far as the upper extremities are concerned. It will be in the brachium, but then when you get into the antebrachium, there is going to be a rotation where the palms are going to rotate and face dorsally, and the thumb is going to be medial instead of lateral, which is our anatomical position. So this is a cadaver, this is a cartoon showing what the anatomical position is like of the anterior aspect of the upper extremity. Now this vein here is our cephalic vein. It will go all the way up and lie in an anterior area called the deltopectoral groove. But we will finish that dissection more thoroughly when we turn the cadaver over into the supine position and begin our work on the anterior surfaces. Again, here's our basilic vein. Remember, we have 3 nerves that are going to be accompanying the basilic vein. That is the median nerve, the ulnar nerve, and the medial cutaneous nerve of the antebrachium. Over here, in our cubital fossa, we have an anastomosis between our cephalic and basilic veins. And this is the median cubital vein. Here is still the cephalic, and here is the basilic, but if you'll notice, it's starting to rotate and move in a more dorsal aspect. And the cephalic and the basilic will actually anastomose posteriorly on the dorsum of the hand and create a dorsal venous arch. So make sure you preserve those structures. Right here, this is a median antecubital vein, which can originate off the basilic, off the cephalic, or even off in the median cubital vein. So it just depends upon your specimen. This view also shows you quite a reveal on the area of the wrist. Lots of tendons and nerves as well as blood vessels are found here. Whenever you guys make your skin incisions around the circumference of the wrist, you are to make sure you cut through the skin only, because there will be blood vessels, nerves, and tendons that will be close to the surface. So please exhibit extreme care and caution when you make the circumferential incision around the wrist. Make sure you only go through the skin. If you have to, put a probe under the skin and cut down onto the probe as you are making this incision. This view too is nice because it shows that there is kind of an aponeurosis that is coming off of the biceps tendon, and it's called the bicipital aponeurosis in this area, that you will actually remove as you do your dissection. You will not cut or remove the biceps tendon, but you will remove the bicipital aponeurosis. This vein here is not the basilic vein, it is actually the ulnar vein. And so it's something that you need to be aware of if you expose the ulnar vein, you are definitely too deep. Over here in this view, this is our radial vein. Those structures will not be revealed. Up here in the antecubital fossa, I do want to point out this nerve here. This is called the musculocutaneous nerve. And over here, we actually can see the median nerve, MU and ME. The median nerve is going to go underneath the biceps tendon. And then you can actually see here is our medial cutaneous nerve of the antebrachium, and our ulnar nerve you will not see in this view. Let's go ahead and take a look at this next view here. The bicipital aponeurosis has been removed. Again, here is our musculocutaneous nerve on the surface of our brachioradialis muscle. So let's actually talk about some of these muscles here on the anterior aspect of the antebrachium. Here is our brachioradialis. This muscle, it's important that you identify it. It's on the thenar or thumb side of the antebrachium, and it's a good starting point for identification of anatomical landmarks, whether you're working on the anterior or posterior aspect of the antebrachium. Now, up here, adjacent to the biceps tendon, is our pronator teres muscle. Then, as we go along, here is our flexor carpi radialis muscle. Adjacent to that will be our flexor digitorum superficialis muscle. Lying on top of that, if the specimen has it, is a palmaris, palmaris longus muscle. Nice long tendon. Palmaris longus can be absent in up to 30% of the population. So it'll be laying on top of the flexor digitorum superficialis. Then over here, I think I've showing the flexor digitorum superficialis. Lateral to the flexor digitorum superficialis is medial to the flexor digitorum superficialis is our flexor carpi ulnaris. So, those are the muscles that you need to be able to identify, as well as the nerves and the blood vessels, and that is your task this week, to expose all of these superficial structures of your specimen. Good luck.